Moving valgus stress for medial collateral ligament. Okay, we go to the first slide, anatomy of elbow. It consists of humerus, ulna, and head of radius. It also have involvement of pivot joint and hinge joint. The movement of joints area are flexion and extension. The nerve for elbow are medial nerve, radial nerve, and ulnar nerve. Second slide show the function of elbow. First, important for activities of daily living. Second, elbow functions as fulcrum for forearm lever. And third, elbow act as a lever when positioning. There are three common injuries at the joint, which are epicondylitis, dislocation injuries, and supracondylar or transverse fracture. Here we go to the procedure of moving valgus stress for medial collateral ligament. The purpose for this test is to assess for medial collateral ligament instability of the elbow. Number 1. Patient in upright sitting position. Number 2. Abduct the shoulder to 90 degrees and maximal flex the elbow. Number 3. Then apply a valgus torque to the elbow and bringing the shoulder into the maximal and external rotation. Number 4. While maintaining the valgus torque, quickly extend the elbow to around 30 degrees.
Assalamualaikum warahmatullahi wabarakatuh. My name is Izzah Syafiqah binti Muhammad Syaiful Hanim. Today I will be explaining about special test for tennis elbow or lateral epicondyle, which is NIL test. So for the anatomy of the injury, lateral epicondyle is a condition where swelling of the tendon that bends your wrist backward away from your palm. As you can see in the picture, it shows tendons that involved in this injury is called extensor carpi radialis brevis. So next is common injury and mechanism of the injury. The mechanism of injury usually involve repeated stress to the large muscle group on the outsides of the elbow and forearm. So these muscles can also suffer small tears caused by improper technique or muscle weakness. So the last is procedure of the test. For the procedure, it's a must that the patient in the standing position. Then while you palpate lateral epicondyle, fix the humerus. Then passively pronate the patient forearm and fully extend the elbow and flex the wrist. And remember, if the patient complains of abrupt pain at the lateral epicondyle, the test will be positive. Thank you. So first thing first, make sure that the patient is in standing position. Then while palpating the lateral epicondyle, fix the humerus. Then passively pronate the patient forearm and fully extend the elbow and flex the wrist. And remember, if the patient complains of abrupt pain at the lateral epicondyle, the test will be positive. So this is when the patient is complaining of abrupt pain at the lateral epicondyle. So this is the close view of the procedure of the test. That's all. Thank you.
Hi, Assalamualaikum. My name is Aiman Aibi Maslan. Today I want to show to you the presentation of the golfer elbow test. So this is a special test for golfer elbow. So let's get through for the presentation. So the anatomy of the injury. So the pain golfer elbow occurs primarily where the tendon of the forearm muscle attached to the bony or bump on the side of the elbow. So actually there is another name of the golfer elbow, that is medial epicondyle. So the pain of tennis elbow usually occurs at the bony bump on the outside the elbow. So that is the tennis elbow difference that between the golfer and tennis. So the common injury that is many things that make your elbow hurt, such the common that make the elbow hurt is because of the tendinitis that the inflammation or injury that tendon that attach muscle to bone. So mostly there is because of the sport, or maybe like golf or tennis. So we go to the mechanism. So the ulnar collateral ligament of the elbow is most often injured by repeat stress from overhead movement. So this motion is common in sport that involve throwing, such as baseball or javelin. So the procedure how to treat the golfer elbow is you have to make sure you have to examine the patient, that you have to know where the pain, where you have to locate where the pain it is. So after you find the pain of the patient, you have to supinate the arms of the patient slowly, and then make the flex for the patient. And I will show you another slide and another demonstration for the video, and I will tell about that the procedure, so you will get. So for do and don'ts, you have to for do and don'ts, do make sure that patient is ready for the treatment. And then for don'ts, extending the elbow upward for the patient, it will make worse or cause another injury. So let's go. Hello, this is for special test for golfer elbow. So firstly, you have to know where the pain is located, and then you should know that the patient should be relaxed and seated, and make his finger flex in first position. So the examiner palpates the medial epicondyle with one hand and grabs the patient with wrist with other hand. So the examiner then basically supinate the forearm and extend the elbow and wrist. So a positive test will be a complaint of pain or discomfort for along the medial aspect of the elbow in the region of the medial epicondyle if patient have some emotion or some movement. So that's all, and bye.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Akmal Zulkifli. I am from RH12454A. Today I want to talk about the tiny side of the special test on the ulnar collateral ligament. The ulnar collateral ligament is a complex that located on the inside of the elbow, on the pinky or the middle side. It also attached on the one side to the humerus, the bone of the upper arms, and the other side to the ulna, that we call it a bone in the forearms. A UCL consists of three bands or division: the anterior, the front, posterior, the back, and the transverse. Transverse is the across of the bands. Now we move to the common and mechanism of ulnar collateral ligaments. It's a sudden pop or pain along the inside of the elbow, and also leading to the inability to continue throwing. UCL tear from overuse. The ulnar collateral ligament can be injured in the several ways, but mostly there is a gradual onset of the elbow pain due to repetitive stress on the ligament. This is especially common in the athlete who play sport that requires overhead arms or use the throwing. Next, ulnar collateral ligament for the injuries in children. Children is the particularly baseball pitchers under the 50 age may occur to develop UCL tear from the repeated stress. It's also important to remember that pain when they throw it is not a normal for the young children. It should be addressed immediately to prevent further injury. Traumatic UCL injuries. The ulnar collateral ligament may also be injured if you fall off your outstretched arm. In this case, the UCL may rupture or get pulled of the humerus, and it be chipping a small piece of bone. This is, we call it an avulsion fracture. It is the rare disease. This type of trauma is sometimes accompanied by elbow dislocation or the elbow fracture. Now we move to the procedure of the tiner site. Number 1, make sure the athlete show the flexion for over 45 degrees. Tapping between the electron and the muscle nerve. That is the nearest of the ulnar collateral ligament. Tapping for almost 30 seconds to 60 seconds. Make sure you pressure on your tapping, and after finish your tapping, try to ask your athlete if he feel the pain or not. Okay, that's all for me. Thank you. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Akmal bin Gapli. I am from RH14548. Today, I want to demonstrate how to do the special test, the tiner site. Okay, firstly, make sure his hand flexion to the 45 degrees of or below. On the between of the electro and the muscle nerve, this one, tapping it for almost 30 seconds to the 60 seconds. Put the pressure on the tapping because we want the positive result. Okay. After finish tapping, ask the client, do you feel any pain?
Yes,
On what area?
on this area.
On this area. Okay, this area we call it ulnar collateral ligament. Okay, that's all for me. Thank you for watching my video.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Hafif Azan Abedul Raslan. My number mental 2020946269. I'm from RSR 24548. So I'm going to explain about the prone push-up test. So let's check it out. The problem push-up test is an orthopedic test for the elbow. Posterolateral rotary instability is the most common recurrent instability of the elbow. It occurs secondary to a traumatic or iatrogenic injury to the LCL. Symptoms are due to recurrent posterior radial head subluxation, manifested as lateral elbow pain or mechanical symptom when a load is applied while the elbow is in inflation and supination. The elbow comprises a complex of bony and ligamentous stabilizers that provide both primary and secondary construct to elbow stability. Through trauma and overuse, classic instability pattern arise by loss of this important stabilizer.
Can be on the floor or an electronic table. The shoulder are be tilted to 90 degrees in the forearm are supinated. We're going to ask the patient to perform a push-up. We're going to watch their elbow.
And the result is negative because the patient has not apprehension.